Again, thank you for being here to celebrate the opening of this behavioral health care center for children, youth, and families. It's taken about 140 years to get to this day if we think about how long Seattle Children's Home has been around, or almost 100 years if we think of Ruth Dykeman Children's Center and how long that's been around. The merger of Navos with Ruth Dykeman Children's Center in 2010 and with Seattle Children's Home in 2012 gave us the ability to combine the resources of both and to give a 21st century incarnation to this campus. Ruth Dykeman Children's Center has been serving children here for a long, long time, and we took down 5 buildings and put up our 6 cottages and our outpatient building and the apartment building for young adults coming out of the foster care system. And we were able to remodel the 2 remaining buildings on the campus, one as a school and one as offices. And when we decided to pull everything together, we were excited about the ability to create a continuum of care on one campus that could serve young children all the way through people up to 24. We know that brains don't start developing until 25 or 26, and so it's good to be nourishing those lives here as well. The reason that we built the cottages the way we have, and if you haven't had a chance to look at them, I hope you'll do so before you leave. Before that, our program for 13 to 17-year-olds up on the Queen Anne campus was in a unit built for 30 people, and it was built more in a hospital-like setting than a home-like setting. And we believe strongly in our trauma-informed care way that something that's home-like and cozy and warm promotes better healing. And that's why we replaced the 30-person unit with 5-bedroom units, more home-like units, and we have been learning how to do that, and our clients have been helping us figure out how to do that as best as possible too. We also use some of those cottages for a behavioral rehabilitation program that was on this campus for decades, and that's for 6 to 12-year-olds. These are people who may have been removed from their family, their foster home, because of abuse, neglect, even violence. And they may come to us in the middle of the night with nothing but what's in a garbage bag of all of their belongings. And so again, we wanted to create a warm, home-like environment for them as well. Those units are also used for kids who may only need a 30-day assessment period, maybe a short-term respite from family or whatever. This outpatient building that is behind you, and that used to have a gym right here, but in what we call value engineering, it has a roof. Working with our wonderful architects at Methuen Architects. The outpatient building provides individual and family counseling. We teach life skills classes there. We do alcohol and other drug assessment and treatment. We house staff who go off in the community and work with developmentally disabled adolescents. We also house staff on this campus who go off and work in 45 schools throughout King County. So this becomes a home base. And then over there, that building, that 24-unit apartment building, is for people who are graduating from the foster care system. In the state of Washington, about 500 people a year turn 18. And they are all grown up and can be on their own now, is sort of the theory behind aging them out of the system. Well, of course we know that's not true. And so one of the things that happens for young people who leave the foster care system because of their age, they're very vulnerable to sexual trafficking, to homelessness, to school dropout, to unemployment. And our purpose for Independence Bridge truly is to be a bridge to independence. So they have a supportive community of each other. They have services from our staff in our adult services. And they also have some coaching in adult living skills and so on. And it's been so exciting to see how lives have been changed already by what we've been able to provide there. So that's what this campus is all about, and we have a bunch of people to thank for that. The first I want to mention are the boards of directors of the Three Legacy organization. Each of the boards worked long and hard in deliberation to decide what to do, and in our own ways we came together as the 3 organizations. So not clapping but standing, could all of the former and current board members of Seattle Children's Home, Navos, Ruth Dykeman Children's Center, stand up so we can see who you are. Thank you, thank you. We appreciate so much what you've done. Oh, it's just too hard, I know. Thank you. Jim and Jerry have been very enthusiastic supporters for many years of Ruth Dykeman Children's Center when you were on the board, and have had a real sense of family legacy to this. And Jim and Jerry have been very generous in helping us with the construction of this outpatient building. So thank you for your gift there as well. And Jim, you're going to talk.
What's that?
And it's your turn to talk.
My turn?
Yeah.
Thank you. Well, thank you, first of all, for all the reasons why you came here today, the many different varied reasons, and the reason why this program is still going into the future. For a 100-year period, children started coming here for different reasons. So in the beginning, it was this criminal processing that was going on. And then as the state became larger and more sophisticated and had built more infrastructure, that need started to fade away, and there was not a clientele that was populated enough to continue what was going on in these different residential treatment environments. But about that time, we moved into a period where there was another need that had developed. And people of my generation, you'll remember that living in your neighborhood, living in your school, all of a sudden a young girl would disappear. And we'd never be told why that happened or where she went. And then all of a sudden, 9 months later, 10 months later, she'd reappear. Never was told where she was or what happened. And that's when the program here shifted to become the Ruth Dykeman School for Girls. And that was a place where young women went that were pregnant and not married in teenage level, and would come here, and they had wonderful little guilds, and people would come here, and they would help pastel paint these rooms and put lace curtains on the windows, and it was that sanctuary for that need. Well, all of a sudden, that disappeared overnight when the pill arrived. And so, again, there was not clientele to bring onto this property. But unfortunately, at that time also, the number and statistical development of the children that were being abused sexually, mentally, physically was on the rise, and there was a need that, again, this property could provide. And so it became then the Ruth Dykeman Children's Center. And the programs that you're familiar with now that are here began. So I have an admiration for these young people. They cycle through these programs. They can't do it on the front line for more than 2-3 years, with some exceptions. But they're miracle workers because they believe, they're young, they believe that these children have a future, and they convince these children one step at a time, one day at a time, that that's true. In the meantime, there had been a contact made with David Johnson, and David, who is a visionary, as we all know, when he saw this property and the sanctuarial aspects of what could be done here, it was part of a dream that he had. But the attainment of waterfront property was not practical in relation to the other things that he wanted to accomplish at his side of mental health. But by us being able to say, you give us the infrastructure, we'll give you this, it was a match made in heaven. This is a miracle. And I can't imagine that we're standing here today and looking at another 100 years of this kind of care for children. Thank you.
I now have the pleasure of introducing the Honorable Bobby J. Bridge. Bobby was appointed to the Washington State Supreme Court in 1999, and then she was elected in 2000, elected again in 2002. And before serving on the Supreme Court, Justice Bridge served as a King County Superior Court judge for 10 years and as the presiding judge over the 51-member court for 2 years. Throughout her judicial career, Justice Bridge was active in efforts to improve the administration of justice for children and families. And upon her retirement, she became the founding president and CEO of the Center for Children and Youth Justice, just a phenomenal organization. And Bobby, and the mission of that organization is advancing justice for and embracing the lives of children and youth through juvenile justice, child welfare, and related systems reform. Bobby was one of the leaders of Seattle Children's Home Board, participating in the work to bring our organizations together, and she's continuing to this day to make wonderful things happen throughout the state. Welcome, Bobby.
Thanks so much. This really is a dream come true, and thanks so much to the Dykeman family for making this happen and persevering over those 100 years so that we could keep this magical place open. I'm here today with my hat on as the former board chair of the Seattle Children's Home and now a proud member of the board of Navos. It was in 2011, during my term as board chair for the Board of Trustees at Seattle Children's Home, that a discussion began with Navos about how we might enhance the partnership between our two organizations for a lot of the same reasons that Jim just mentioned. Navos and the Seattle Children's Home had enjoyed a long collaborative relationship. Its executive director, Dr. Gina Palm, had worked closely with executive CEO here, David Johnson. And with the landscape changing in the delivery of mental health treatment to children and youth, it seemed a favorable direction for us to pursue this expansion of our relationship, but also of value to the health of both organizations and to the communities that we serve. So in 2012, a merger was completed, and the vision for a campus which would combine the legacy programs of Seattle Children's Home along with those of Ruth Dykeman Center, who, as mentioned, had previously merged with Navos, and Navos itself was born. Dr. Gina Palm joined the staff here of the newly merged Navos and led the implementation of that vision in just 3 years in what you see today. And Dr. Palm, I wish she was here today, but she's being a grandma in Colorado. I'm so proud to be here to celebrate this beautiful campus, and really it feels like a heavy sigh with all of the difficulties of being in an era of times of hard money from both the public and private sector. And you've heard all the wonderful friends that we have made and the support that we've had in bringing not only our three organizations together, but also to support our efforts. We now have, as David mentioned, an entity that can serve children and youth with a continuum of care and support that treats these most vulnerable in our community with compassion and respect. It is indeed a grand opening today. I'm particularly pleased and urge you to see, if you have not, the completed cottages which house the long-term residential treatment programs for youth ages 13 to 18 years of age, which CCYJ, the Center for Children and Youth Justice, has spent so much time on. This program was relocated from the Seattle Children's Home campus atop Queen Anne Hill for many years at that location. It's just one of 4 such programs in the state of Washington. This program helps those teens with the most difficult issues, including the onset of major mental illness, self-mutilation, suicide attempts. And they are kids many of whom have experienced abuse, foster care, and bouts with the juvenile justice system. The former buildings, as David mentioned, although in a beautiful spot atop Queen Anne Hill, were institutional and cold, hardly showing the love and respect that these children and youth so sorely need to thrive. And now look, please go see them and visit the open cottage today to see the contrast, a home-like environment offered to these youth through their treatment and healing. These comfortable and warm cottages where residents live in a small group of 5 are far more conducive to healthy youth development and to healing. This new campus is a true community asset. It was born in this community, and it is now a part of this community. We know that treatment and early intervention for children, even with these most significant mental health and emotional problems and these tragic, long-term traumatic stages of development up to this point, we know that treatment is effective, and we can help to stop the cycle of poverty, trauma, and addiction, which so often follows, by providing these kids with treatment and supports like those offered here. And it's our responsibility as a community to do so. So thank you all for being here today, for your support of and your investment in children and youth. And now I'd like to introduce to you Matt Milan, the president of the board of this newly organized Navos.
And thank you, Bobby, for leading that effort to bring these organizations together. It's really, and for choosing Navos. You both of these organizations, Navos, or Ruth Dykeman and Seattle Children's Home, chose Navos as their preferred partner in this venture. And that is so honoring to us. And Navos recognizes that we're all stronger together after this merger. Your mention of this is a miracle, and it really is a miracle, and it continues to be a miracle that we have to support, that needs our support, because the combined entity of Navos is not super financially strong, let me say. So this has been a stretch to put this together for us. And so it's very important to have all of your support here today. Navos, I want to tell you why I believe in Navos and why I'm the board president, why I took on that role and was willing to do that. And it's because Navos stands for transformation, personal transformation. And I believe in that kind of transformation because I've experienced it myself. I believe that emotional pain, grief, trauma, and all sorts of mental disturbances can really be transformed into sources of strength. David mentioned our being a strengths-based organization, and I believe these very things that we think of as detriments can be and will be sources of strength and compassion and kindness and joy. When we're confronted, let me tell you the way that I think that happens. When we're confronted with our own vulnerability, we see our pain and our limitations. We recognize our vulnerability, and then we also can recognize the vulnerability of others as well, and really connect in that important way with others. And when we do that, we feel moved, spontaneously to take care of others, just as we wish to be taken care of ourselves. Let me tell you a few things, a few little details about how this campus is like that, and how it shows trust, respect, and confidence for the folks who live here. One child living over in, I think the BRS program, said he'd never lived in such a nice place. And he was just honored to be here in such a beautiful building, and it made a big difference for him. And as you've been in the cottages, it's really great that we got to have one open for you to visit. You can see how they have real furniture, they have real appliances, they have microwaves that you could throw across the room. They're not institutional in the sense that they're fragile, like home environments, and that also creates the opportunity for children to learn care for things and for others in those situations. I want to thank one person for whom we really owe a great debt for this place, and that's David. David has been. Thank you. David has been bringing this vision to life at Navos for 17 years, with great devotion to empowering our partners in healing with children to share their wisdom with others. And one particular example of that, not necessarily in the children's program, but is the peer programs that we have, which are where someone with lived experience, with experience of the kind of mental disturbances that everybody's suffering from, becomes empowered to help others with those same experiences. And they can do things that other professionals really can't because of their common experience. So thank you, David, very much. And I'm pleased to introduce our next speaker, who is Trudy Inslee. Trudy has raised 3 kids on a farm, acres of alfalfa, as I understand it, surrounded by apple orchards. So her household really might have looked a lot like the household of Jameson Ranch. We had a big ranch house there. And what a wonderful environment, Trudy, to give to your children. I saw a picture of your grandson getting on the school bus on Facebook.
Yeah.
And as I walked down here, I actually saw one of the kids from VRS getting on a school bus and looked just like your grandson. And let me say a few other things about Trudy. Okay, all right. Here you go.
Thank you, Matt. Really appreciate your comments. And your singing. You did a great job. Thank you all for being here. We really appreciate everybody being so involved in this great celebration today. And I've learned a lot already today, and I'm sure many of you have also. So as Matt referenced, as parents and now grandparents, it has always been a priority of Jay and me to improve Washington State schools and child welfare programs. Our goal is to ensure that all children are provided with the services they need to succeed, food to eat, a safe home, a caring family, a good education, and of course access to both behavioral and primary health care. I'm pleased to be here today to celebrate with all of you the opening of this new campus, which adds critically needed programs for our children and youth. With the completion of this center, children and families who are struggling with mental health or addiction issues and other significant challenges have a safe and welcoming healthcare home where they receive treatment and support. Our administration has made it a top concern to work for lower costs, more transparency, and a system that integrates mental health care and primary care. And this started back in the Clinton administration. I was a member of a spouse group that we tried to have mental health be equal to other health issues. And so it's so great to see the stigma being removed from mental health care issues. Navos has been a leader in many of these areas, including the establishment of primary care clinic on their other main campus, which serves adults. And now with the plans to include a pediatric primary care clinic here on this campus, Navos will ensure that the youngest and most vulnerable in our community receive preventative and regular medical care in addition to behavioral care. In the latest budget, we had significant wins, as was referenced, which we're very happy to have delivered, and thanks to all of those who were involved in that effort. And I urge all of you to continue to be squeaky wheels with your legislators about future needs. I'm also very pleased that Navos has added a program here to help young adults graduating from the foster system to independence, because every year in Washington, approximately 35% of youth aging out of foster care end up on the street during the first year after being emancipated. And this is a really critical thing to try to prevent. We have, with the passage of the Senate Bill 5404, we created the Office of Homeless Youth Prevention and Protection Programs in the Department of Commerce, which will educate and prevent youth and young adult homelessness by increasing and improving the priority services that they need. The new office is directed to decrease the number of youth who experience homelessness, identify the causes of youth homelessness, and increase the number of unaccompanied homeless youth who can be safely and appropriately reunited with family. We'd love them to all be reunited, but that doesn't always work, as I'm sure many of you know. If a young person does experience homelessness, our goal is to make that rare, brief, and one time. It's a great step forward here to help children, youth, and families, especially those who are marginalized by poverty and those who are stigmatized by having mental illness. With the help of wonderful organizations like Navos, we can join together to improve systems that help the most vulnerable in our society. I thank Speaker Chop and Senator Kaiser for being here, and I really wish China's president could have stopped by here. I think it would have been great, don't you, David? I think we need this internationally. So thank you all for being here, and keep up the good work.
As many of you can imagine, Trudy Inslee is a folk hero in the health and human services community for so much that she's done through the years. We're about to let you guys go. Thank you so much for being part of what we're doing today, reminding you that there are many ways to help children coming up with the holidays happening. You might want to go on our website, follow us on Twitter, like us on Facebook, and we gave you care packages. Those are not little goldfish or Chinese food. So take care of yourself, take the care package with you, and give back the name tag, because we'll make you come back here again someday. Thank you again for being here.